I started reading about stem cells like in 2000, and to me it was the future, Star Trek. I prayed maybe my children one day would see stem cells in their future, never dreaming that in 8 short years we would be able to start doing it in our own practices. So for me it was very exciting because I had been reading about them, learning about the potential, just not knowing if it would be realized when I was a vet. And in fact it has. And so I'm one of the happiest guys on the planet that I get to actually offer this service to my patients and help them with treatments that we've had a standard of care that's failing them, osteoarthritis and things like that. So it gives us another tool, and it's a new paradigm shift in my practice. So we have this tool that we can help regenerative medicine, and I think what we're doing is we're actually working towards a better health span for these animals. It's not all about lifespan, my philosophy. It's not all about just living longer. It's being, living longer with a quality of life, and that's what I call health span, and I'm real excited about that. Medivet has allowed me to do it in-house. I didn't want to ship something across the country, me personally, because I live in Western Pennsylvania and we can have blizzards and we can have inclement weather and cells may not get back to me. So for selfish reasons, and I was always very comfortable with laboratory techniques and it's very simple, I was looking for an in-house technology, and Medivet came forward with a phenomenal one. Well, now it's the world's leading technology, and I have no reason to leave. I'm a general practitioner, and I have 3 associates that are general practitioners, and we're all excited about what regenerative medicine has brought. As a veterinarian, you get animals, and the research doesn't always catch up as quickly, and this happens in human medicine too. You get animals that have conditions where we've run out, the standard of care is no longer working. We've run out of things to try. The dog can't get up anymore. It's got too much pain from osteoarthritis. The owners might not be able to lift the dog up to take it out to go to the bathroom easily because the dog might be heavy. And the quality of life is really horrible. And so we had, after the standard of care, maybe they're reacting to those drugs now. You give them non-steroidal anti-inflammatory drugs, or you give them steroids, and now they're having reactions to that, and they're not having a good quality of life on those. And so before, the only option left was to humanely euthanize that animal. And not one veterinarian in the world would be happy with that alternative, but it was part of a necessary transition, unfortunately, because they were suffering. Now enters regenerative medicine. Now we get to give them stem cells. And those dogs that we were once putting to sleep are now walking, happy, and it's not just the vet seeing it, it's correlating, the owners are seeing it too. And the owners then start talking about it in the community, and you hear these stories about, I got my puppy back. And I said, it's not a puppy, but your dog's out of pain now, your dog feels better. And it's very rewarding because as a veterinarian, owners come in and hug me and thank me, through tears sometimes, for things that I'm doing because of stem cells. I'm not making those stem cells repair that joint or reduce that inflammation, but obviously that's what's happening, and these animals are benefiting from it. So a person that wants to help animals, you couldn't be happier to be using a tool like this, and Medivet brought it so that we could do it in-house. I have trouble restraining myself, I really do. I look at people and wonder why, now that we have evidence from the universities, they're going to have a tough time giving me an answer why you aren't incorporating this into your practice, because you need it. You need to see this 21st century tool of regenerative medicine, and that's why people, they kind of latch on to the excitement, and they know that I'm telling them the truth. And when you have 10,000 veterinarians around the world getting the exact same results that I'm getting, it just kind of verifies that all veterinarians want to bring this into their practice if they can. And I want to do anything I can to help them transition that into their practice, answer their questions, help them pick cases if I can, and talk. And that's why I come out and agree to speak, because I love sharing this. I want my colleagues to hear it. I might be able to treat 300 animals in my practice in a year, but what if 10,000 veterinarians are treating 10 animals a year? Look at those numbers. We're helping a lot more animals.